Hello friends, today we will discuss another important topic in communication station, counseling a teenage girl requesting contraception in a clinic. In MRCPCH clinical exams, the communication station carries 8 marks, total time allotted 8 minutes. In introduction, a teenager may seek contraception for various reasons. A sensitive, non-judgmental and confidential approach is extremely essential. Address health, legal and psychosocial aspects. There are true principles for adolescents confidentiality. The first one is academic competence. It is a legal term used to decide if a child under 16 can consent to medical treatment without parental consent. It is used in England and Wales. How is Gillick competence determined? First, a child maturity and intelligence are assessed. The child's ability to understand the treatment, including risk and alternatives. And the third one, the child's ability to manage influences on their decision making. When this Gillick competence is used, when a young person wants treatment without their parents' consent or knowledge, when a young person parents don't agree with their decision. What does the Gillick competence mean? It is a reflection of child's transition to adulthood. The degree of maturity and intelligence needed depends on the decision's gravity. Where does the term come from? This term comes from in 1985. A case was lodged by Mrs. Gillick versus West Norfolk and Westpac Area Health Authority. In this case, Mrs. Victoria Gillick wanted assurance that her daughters would not be provided with contraceptives or abortion advice without her prior knowledge and consent. Now let's discuss the Fraser guidelines. These are the set of criteria that allow doctors to provide contraceptive advice and treatment to young people under 16 without parental consent. The guidelines apply in Wales as well as in England. When the Fraser guidelines apply, the young person is unlikely to tell their parents. The young person is likely to have sexual intercourse without contraception. The young person's health is likely to suffer without contraceptions. It's in young person's best interests to receive contraception. And how the Fraser guidelines are applied. The doctors should encourage young people to tell their parents or carers. If the young person cannot be persuaded to tell their parents, doctors can provide advice and treatment if the criteria are met. Doctors should make sure the young person understands the advice well. The confidentiality must be maintained unless the young person is at risk of harm or there are safeguarding concerns like coercion and abuse. Establishing rapport. You can use open-ended questions. How can I help you today? Maintain a non-judgmental and supportive tone. Ensure a private and comfortable setting. Assessing Gillick competence. Can the teenager understand the treatment options, weigh the benefits and risks, make an informed decisions? These are the three questions you need to know. If the child becomes competent, or the adult or the young person is competent, and they can give consent without parental involvement. Exploring motivations and risk. Why is she seeking contraception? Is the relationship consensual and age appropriate? Assess risk of STIs and unintended pregnancy and coercion. Discuss the emotional and psychological readiness. What are the options? The first option is a barrier method using condom that can protect against STI as well as a pregnancy, Hormonal contraception pills are available in the market. First one is the combined contraceptive pill, which is comprised of synthetic estrogen and the progesterone. The combined pill you need to take in 20 for 21 days, and there are 7 placebo pills that is to be taken for the gap of 7 days. And there are some patches also available that can last for 7 days, and you need to have a 7 days break in every month. And some injections and implants are also available in the market. If the implant has been implanted within the first 5 days of period, then no other additional contraception is advisable. But if it has been implanted within the period, then for first 7 days the young person should use the other method of contraception. There are long acting reversible contraceptions are also available, like IUD, like the copper T, and the implants as well. Emergency contraceptions, if at risk of unintended pregnancy, there are 2 varieties available. The first one can be taken within 72 days, the other one can be taken within the first 120 hours, that is for within the 5 days of having unprotected intercourse. Sexually transmitted infections, the right information to be given to every child, and discuss the risk of STIs and importance of condom use. Offer STI screening if appropriate, and explain the symptoms of common STIs like the chlamydia. There could be purulent or white discharge, foul smelling could be there, lower tummy pain. It is also present in gonorrhea as well. In HPV infection, there could be some wart or papule, which are mainly painless. And safe and healthy relationships are always encouraged. Discuss the consent, respect, and healthy relationships. Address peer pressure, question, and red flags for abuse. Provide support if concerns arise. Safeguarding considerations. Assess for coercion, exploitation, or abuse. If concern arise, follow child protection policies, and you can call the social workers and the police if required. Ensure appropriate referrals if needed. Signposting and resources. Always inform them that they can directly contact the sexual health clinic, and online resources and helplines are also available. Encourage open conversation with trusted adults, and provide confidentiality assurance with safeguarding limits. Summary and take home messages. Empower and educate the teenager. Ensure informed choice about contraception and STIs, and maintain confidentiality unless safeguarding issues arise. Encourage safe, consensual, and healthy relationship. If you have any question or any doubt or any reflection, you can comment below. Thank you very much for your love and support. Please like, share, and subscribe my channel. Thank you very much.